My name is David Slepak. I'm the Executive Vice President here at ACOS. I'm broadcasting live from Phoenix, Arizona. Thank you so much for joining our webinar today. Hey, we have an exciting presentation for you, really based around our employer solutions. And I'm excited to present them to you today. Today's intention, we're going to review and visit what DPC is, or value-based primary care. DPC, if you're not familiar with the term, is direct primary care. And fundamentally, we are engaging in a solution really designed to increase access to care and reduce cost. One of the things that advisors and consultants who are familiar with DPC come to me and say, David, I love direct primary care, but man, I need to scale it. It's really hard to scale, right? And when you're basing it or grounding it in the brick and mortar strategy, it's really hard to scale. So what we're going to talk about today is scaling DPC to any employer, regardless of size or geography. One of the other things that we facilitate, and again, consultants come to me every day and say, you know what, David, I love direct primary care, but I don't get any data, right? I don't get any reporting. And we're going to address today how we can facilitate that and remove that barrier. Because look, when you're putting in this type of solution, you want to be able to show a return on investment. We're going to show you how to leverage ACOS technology to reduce costs and build a culture of health with an employer. I'm going to show you the strategy to execute cost containment strategies with high engagement and precision. We'll review our on-site and near-site strategy, which is really a game changer, bringing those types of solutions down to groups as low as 500 lives. I'll briefly go over our workers' comp solution today, and this is designed to lower EMOD scores, driving down workers' comp costs. And then we'll wrap it up looking at target markets, benefit designs, easy implementation, and of course, commissions. I'm not going to spend a whole lot of time on this slide, but look, our healthcare system has a ton of challenges, and really it comes down to access to care. Not only is there a shortage of providers in this country, but there are so many barriers that need to be removed for the average person to receive just basic services for primary care. Typically, I pause at this slide, and it's one of my most favorite parts of this presentation, and I want to make sure we're all on the same page when it comes to the solution that we're bringing to the table. So, I have a really good friend and consultant in South Carolina. His name is Tom DeLagro, and we were sitting at a conference one day, and we were talking about care and direct primary care, and he starts to use an analogy, and I give him credit for this because there's episodic care, teledoc, urgent cares, minute clinics, and let's just pretend we're all going to go for a ride to the airport right now. We're going on a trip, and we're going to hire a taxi cab or maybe an Uber, right? So that's a one and done situation. We're never going to see that driver again. They're going to get us to the airport and it's over. They don't know what we like to drink or what music we like to listen to when we're coming back. And that's just like episodic care. That's just like teledoc or an urgent care, minute clinic. You go in, you have a sinus infection, they give you a Z-Pack, you leave, right? It's a dead end. With direct primary care, this is a continuous relationship with a primary care physician, okay? And Tom, he made a great point. He said, look, that's like you and I going to the airport in your own personal car and your own personal driver. That driver knows everything about me, knows what kind of radio station I like to listen to, how I like to go to the airport, when I'm coming back, when my next trip is, and that is the fundamental difference. So when we use words like virtual or use words like telemedicine or technology, I want to make sure we're all on the same page with regards to the solution that we're bringing to the table, because it is fundamentally a difference in how we come to the market and ultimately the services that we're able to provide. Why value-based primary care? Look, I think there's two huge pieces of the puzzle here that really helps define primary care in the value-based solution, right, or direct primary care. I think the first one really is around the payment methodology, if you will. And by going to a membership-based model with a per employee per month or per member per month, it really helps align the provider's interests with the users and purchasers of healthcare's interests, right? And I think fundamentally that is a huge part of DPC, right? I think the other huge part of DPC is that one-to-one relationship, that continuity of care that comes with working with the same doctor over and over again. And I use another analogy, right? Let's say you have a job and you have 15 different bosses, right? And every time you have a question, you have to go to a different one, and no one's on the same page, right? You would have a hard time getting anything accomplished in that type of model. Well, in this particular model, you got one doctor, and that doctor is going to do all sorts of things like care navigation and clinical collaboration. Our providers engage in population health management. We provide a superior patient experience, evidence-based medical care, participation and sharing of medical records, pharmacy support, behavioral health, and in our platform, real-time intelligence, analytics, and reporting. As an industry, we see a lot of data and ultimately some significant reduction in cost. About 17 to 21% reduction in total healthcare costs is what we see. Significant reduction in primary care claims, inpatient claims, and because we're so intentional about the relationship and employee engagement, we see a super high engagement rate. I'd like to share with you a little bit about the organization. Founded by Dr. Nod and Dr. Singh. Dr. Nod is a cardiologist here in town and really the entrepreneur of ACOS. Dr. Singh is a neurologist by trade and had the vision for all of the technology that we're going to show you today. Dr. Lee, he is a fantastic guy and really interesting, our chief medical officer. He actually has developed all the protocols for an organization called MedAir, which is an organization that airlines hire to take care of passengers and crew at 30,000 feet. Now, talk about virtual medicine to the extreme. That's what Dr. Lee has developed the protocols. The other thing that he brings to the table is some chronic disease management experience, specializes in diabetes and neuropathy. So again, a really well-rounded team that has grown over the years. A little bit of company history, and quite frankly, I share this with you because it demonstrates the core competencies in the building process of where we're at today and the product we're going to talk about today, which is our direct primary care solution. So founded about 4 years ago, really in the workers' comp arena, we developed the first telemedicine app, process, and provider network that really addresses the core challenges of workers' comp, and that's what's called speed to injury. Now close your eyes for a minute. Your work site, the employee gets hurt, you got about 1 minute before that employee and or the supervisor is sending them to the emergency room, right? Or Concentra or the urgent care facility. And that might not be the right place at the right time to service that. So what we developed is a process of technology. Within about 15 to 30 seconds, we can have an RN on a video call recording the whole thing. Triage, provide first aid to that injured worker. And then if that nurse feels necessary, he or she can actually bring on an occupational health physician to continue the care in another 15 to 20 seconds. It is game changing in the workers' comp arena and something that we have been very successful in reducing both the frequency of claims and the severity of claims, right? Because now we're able to facilitate all sorts of things to keep them out of the hospital. Certainly more relevant than ever, because who wants to be in an ER these days, obviously, with the coronavirus and other things. So again, has brought some real light to this solution. Within about 30 minutes of the conclusion of that call, we're actually giving them work instructions, return to work instructions, limited duty instructions, as well as care instructions, and then facilitating all of the industrial forms required for state filings, et cetera, et cetera. So core competencies, look, we've developed some really neat technology, a very unique provider network, and fundamentally, we're able to care navigate folks based on the rules of the state, because every state, there's 50 of them, have different rules around workers' comp, and the underlying plan design, whether there's a network, et cetera. Super, super important pieces as we develop our solution today. About 2 years ago, we developed a strategic relationship with Albertsons and Safeway grocery stores and developed some technology and a process around a walk-in retail clinic inside those grocery stores. Now, I'm not super excited about retail walk-in clinics, but what I am excited about is our ability to leverage those clinics for our employers for near site. But even more exciting are the core competencies that we built around running an on-site clinic. And that is something that we've been able to leverage in our employee strategy solution. In 2019, fourth quarter, we launched our virtual direct primary care solution, taking all of the core competencies that we've built over the last 4 years into, in my opinion, and I might be a little biased, the most advanced employer healthcare solution on the marketplace today. Hey, some notable clients that we've embedded this product and workers' comp in several different plans, Kohl's, Michael's, et cetera, et cetera. You can see we have some great clients that we serve today. We've also started embedding the virtual direct primary care solution with some hand-selected TPAs that are focused on reducing costs and building value. We've embedded it in some cost share solutions, as well as some low-cost affordable plans like MEX and whatnot, like Pure Health and others. If there's a slide that I get the most excited about, it's this one right here. This really outlines the strategy and the thought processes and how we're able to facilitate doing what we do. So look, there are barriers to care: time, money, and transportation, right? I can tell you my biggest barrier to receiving care is time. Look, I got 3 kids. I travel. Well, I used to travel. I'm doing webinars, all sorts of things. Most of my healthcare happens at 8 o'clock at night, right? With an email to my provider. For a lot of Americans, in fact, most, money is a huge barrier to care. In fact, 40% of people report not going to get care because of a copay or a deductible. Look, 50 bucks to go see a primary care physician can be a showstopper to most Americans. How about transportation? And this could be, I don't have a car. It also could be the closest provider is 90 miles away. And for those advisors and consultants in rural areas, that is a reality that we have to deal with. So what are we going to do? We remove those barriers. We partner with a healthcare plan or a TPA or consultant advisor and their employer clients to make this solution zero cost to the employee. We make it ridiculously easy and convenient. How about from your couch at your home? How about from your office? How about from the road on vacation? How about in a tractor trailer, right? For people in the transportation industry. So convenient and so easy. You just engage in that way. One of the things that's so important to this strategy is the relationship that we build with the patient and the provider. I'll give you an example. I go to dinner parties or over to friends' houses or open enrollment meetings for that matter, and I say, hey, men, hold up your cell phone. Do you have your barber on speed dial? And all the men in the room are like, yeah, I got the barber on speed dial. Yep, absolutely. Okay, perfect. Ladies, hold up your cell phone. Do you have your nail technician on speed dial? And all the ladies like, oh yeah, I get my nails done every 2 weeks. Like I got teenage daughters, they get this SMS stuff. Yeah, we get SMS. Okay, great. Put your phones down. Hey, everybody that has their doctor on speed dial, hold their phones up, and the room goes silent. It's crazy because most people in the workplace today don't have a relationship with a primary care physician. We want them to be familiar. We want someone to be able to trust the doctor, and that's what we are hyper focused on creating. How about anytime, anywhere, right? That's so important. Let's remove those barriers as well. Look, so when we position the ACOS physician as the entry point into the healthcare system, we're aligned with the users and purchasers. Now we're able to facilitate referrals, make sure we're delivering the right care at the right time at the appropriate location for imaging, labs, specialists, all the things that we're able to facilitate. Now, what's the opposite of this? You enter the system in the conflicted model, the fee for service model, the emergency room, the urgent care. How about the specialist? How about the worst? This is the worst. The primary care physician that's been purchased by a hospital system. And in those scenarios, they're conflicted, right? They might be contractually obligated to refer their patients to the $3,500 MRI as opposed to the $300 MRI across the street. So as we set the stage and engage in this strategy, we have successfully together separated health care from health insurance. And when we do that, and we are engaged with a provider aligned with the users and purchasers, your employer and their employees, now we can deliver the right care at the right time, at the most appropriate location, and subsequently at the fair price. All right. Now, everything I'm going to show you after this slide is kind of the nuts and bolts, right? Kind of behind the scenes, behind the curtain, how we facilitate what we do today. Core services. Remember I said there's a lot of doctoring that happens between episodes. There's a lot of stuff that you make an appointment for, like a whole health evaluation, management of chronic disease, coordination and referral of specialty care. How about health coaching, changing behaviors? These are the ways we're able to improve the health of a population, address those chronic diseases, facilitate reducing comorbidities, et cetera, et cetera. Look, we all get sick, okay? As I mentioned, I have 3 kids. Michaela is 14, Isabella is 12, Ryan is 8. And, for your parents out there, these kids never get sick during the day and they never get sick during the week. The weekend's coming up. I guarantee you someone's going to get sick this weekend at 8:30 at night on Saturday, right? So we got to provide access to a provider 24/7. And part of what we do is just that. We're able to diagnose, we're able to create a care plan, we're able to prescribe when appropriate. We can follow up, we can make a referral, we can provide prescription refills on demand, right? But the difference is when they're calling or in need of care, they might talk to their doctor that's on call, right? Your primary care physician might be on call that day, 8:30 at night on Saturday. However, if your doctor's not on call, right? Just like in the brick and mortar, what happens? You see your doctor's partner in the practice, and that's exactly what happens here at ACOS. Your doctor's not on call that day, you'll see the provider that is on call, but they're on the same electronic medical records. They have the same access to all your medications, and we're able to facilitate that continuity of care that is so vitally important in the market today and taking care of people. How about care navigation? I would argue that 50 to 70% of the cost savings on a plan comes from care navigation, right? We have a very intense company onboarding process. I want to know and make sure my team knows all the plan parameters. Is there a network? Is there reference-based pricing? Who's the reference-based pricing vendor? Hey, consultant, have you put together some local contracts with some health systems in your area? How about specific cost containment measures like musculoskeletal or specialty pharmacies? When we're the doctor, we can engage in what I like to call air traffic control. And as long as you tell us all the runways out there, we can make sure we land those planes at the right runway. Okay. The care navigators use the ACOS care management module to facilitate this. Technology is required to make this happen. We use third-party tools for quality metrics. And then this fancy pants word here called interoperability, we're going to deliver to the member and our team a unified health record. Again, the goal here is to provide high quality care at the right timing, at the most appropriate location, and at the fair price. As I mentioned, we started off in the workers' comp arena, and this is a great graphic of what we do in workers' comp land. You know, about 80% of the calls that we take, we're able to shut those right down on the phone, on the video call with the provider. About 20% of the folks that we engage with do require either an in-person visit or some further diagnosis. Again, we become the treating physician, and we're able to order those additional services like radiology, labs, et cetera, et cetera. Coordinated additional services. Again, remember, we're air traffic control. We're there to land planes on the right runway. We have access to partner with Sano Surgery like Dutch Rojas, laboratories, radiology, bundled outpatient surgery procedures that are a fraction of the cost of those done in the hospital. And the quality and the outcomes are typically far superior. Jim Milway at ZeroCard, we've written lots of cases with, and we're having a great time doing it because we are able to facilitate that engagement with these coordination of additional services. How about mental health? Employee assistant, virtual counseling, virtual psych, addiction medicine, and sleep apnea. These are all additional services. And then anything that you bring to the table, as I mentioned, musculoskeletal pharmacy, et cetera, et cetera. The employee onboarding process is so important to what we're trying to facilitate here. When we receive eligibility, and that could be from the TPA, that could be from a Ben admin system, et cetera, we're pumping out emails and texts. We're having a welcome call with every employee with our care navigator, welcoming them to the ACOS practice, informing them of all the services that are free to them. They're engaged in filling out a health risk assessment. We're asking social, behavioral, health-related questions. We're gathering up all of the providers that they're seeing today, okay? At the conclusion of that call, we actually have them fill out a waiver and release of health records so we can actually go out and grab those records and pull them into our system and provide true interoperability, or essentially connecting the dots to those other EMR systems. So we're all on the same page. Think about it. We're the quarterback. We got to be able to communicate to all the people on our team, including specialists, an endocrinologist, a cardiologist, et cetera, and that is what we facilitate. We also put together an initial consultation and greeting with their primary care physician. This is a great opportunity to start forming that relationship. Answer any burning health questions that you might have. Look, for those 10 percenters, those are the folks that cause about 80 to 90% of the cost on a healthcare plan. We want to wrap our arms around those folks, the folks with diabetes, hypertension, COPD, asthma, on pain medication for any reason. We want to jump in and engage those folks right away and be proactive in helping them manage those chronic diseases. This is typically where I go through the integrated care management platform with some static slides, but I'm going to pause for a moment here. Okay, I'm going to pause for a moment. And I like to just show the actual technology, right? I think that's a lot more fun. So give me a moment. We're going to switch gears here. I'm going to log into the actual system, and I can facilitate showing kind of behind the scenes, if you will, of what we got cooking here. Bear with me. Hey, welcome back. Thank you so much. Just so you know, this is a demo call, recording the whole thing, characters, if you will. We got Ace Ventura, but we're going to pick on Adam Johansson here today. Hey, look, when we're engaged in this level of medicine, we're looking at risk need scores, health scores. We're actually making referrals and logging appointments within the healthcare system. So this is a real live timeline of all the interactions that this patient has had with our team and others within the healthcare system. This dashboard comes up on screen pop and it shows if this particular member is enrolled in our chronic care management program. It shows their care team, summary on the patient, any notes, et cetera, et cetera. This is a great overview and allows our team to engage with that patient with precision. As I mentioned, we load in that care team, and it looks something like this. And then we request the medical records to put into the unified health record. And that looks something like this. All the demographic information, any special needs, the underlying insurance plan, fundamental to care navigation, diagnosis, medications, allergies, vitals, immunizations, family history are all provided in this unified health record. We also load in care plans. We log any problems that they might be having. This guy's a mess, right? Everything from dizziness to joint pain to seatbelt use and personal security. I always laugh at that one. Goals. So we put together goals for this patient. Any diagnosis, obviously, medications to support those diagnoses. Health metrics. These are things we want to manage and monitor, like an A1C, alcohol intake, cholesterol, happiness, pain, sleep, water, etc. Obviously, this is a fictional character, but you can get the idea of the things that we want to measure to achieve the health goals, activities, appointments, etc., etc. Super cool technology. This also allows us to do real-time chat. You can see up here in the corner, we have a video capability, so I can initiate a video call. This is actually my favorite one here, the message functionality. Remember, my biggest barrier to care is time. So most of my healthcare, quite frankly, happens at 8 o'clock at night. Now, we're ground level. I'm going to take you up to 30,000 feet. And I can guarantee you there's not a doctor's office in America that has the level of sophistication that we've had here around population health management. So we're identifying risk scores. We're able to drill down into these scores and look at all sorts of things within a population. Joint health, cardiovascular, opioid abuse, which causes our country, costs, I should say, and causes death, right? And all sorts of different things, but costs our country billions of dollars every year. Diabetes control. I'll show you some heat maps here that we can start to drill into a population and understand, especially when we're dealing with folks across multiple geographies, multiple states, et cetera, et cetera. We can deliver a ton of data to an employer, to a consultant. Now, here's the difference. Look, there are a ton of analytics platforms out there, and they're great. They look at claims data and they can splice it in so many different ways. Fantastic. All this information is real time, right? Claims data is 90 to 180 days in arrears. This is real time data, so it's very fresh and very actionable. And that's the key word. I love claims data. I love data analytics platforms. But at the end of the day, how do you use it and how do you act on it? And in our scenario, 8Ghosts MD, as the doctor, we are ideally suited to act on this data. All right, I'm going to pause my screen here for one moment and go back to our presentation. Excellent. Here we go, and bring it back for you today. Hey, look, we talked about the care team collaboration, super important. Again, we're the quarterback of care. We need to be able to communicate with all the people on the team. I get asked a lot of questions about our dedicated provider network, if you will. We have kind of a hybrid approach, right? We have a core ACOS physician group, and then we have about 250 plus providers nationwide that's taking care of our employees. Most of these providers have multidisciplinary clinic experience. Again, we've been curating these folks over the last 4 years, and they're highly specialized. One of the big opportunities that we bring to the table, which is a huge differentiator in this space, is the alignment of our providers and care navigators across the country. So we've developed ACOS University. This is the education platform behind the scenes that we get all of our providers on the same page, training, protocols, all the care navigators understand the underlying plans, because here's the deal. Remember, I said we're going to scale direct primary care. If you're a 1,000-life employer and you have employees in 10 states, the chances are of you having one provider is pretty small, right? You're actually going to have multiple providers around multiple states facilitating the care. So it's so important for us, for all of those providers, to be on the same page from a clinical perspective. Now, compare that to some of these, what we call DPC networks that have been created, which have done a great job of aligning the billing methodology, being able to provide a unified bill for multiple DPC doctors, but it's totally disjointed, right? There's no continuity of anything around the care piece of the puzzle, and that is where the cost savings come. That is where we're able to engage in some of these highly sophisticated cost containment strategies that our advisors put into play. We just execute it for them, right, with precision. Hey, we talked a lot about the product, a lot about the technology and core functionality of what we do. Let's talk about how we connect with our patients, because I think that's very important. We have an integrated virtual care model. It starts with the member portal. It's a device agnostic web-based solution. What we have found is it is the way we deliver versatility. Okay, you can do it from a smartphone, you can do it from your tablet, you can do it from a computer. It's all very scalable. 365-day availability. It's device agnostic. It's obviously HIPAA compliant. There's a 2-stage authentication process, which is really slick as well. Hey, as an option, especially for those groups in that 500 plus category, we can deliver an AI AR powered medical kiosk. It is so cool. I got one in my office. It is really neat, and it delivers an on-site strategy that is cost effective, right? Hey, the last piece of the puzzle is this in-person provider consultation. And that is, again, how we're able to facilitate when someone has to put their hands on you, right? Or a specialist, et cetera, et cetera. So we're providing those consultations and referrals, if you will, to the brick and mortar system. Let's take a minute here and look at that on-site clinic. And I talk about gizmos, if you will. Look at that bottom picture. We have all the gizmos there to do vitals. And we can look in your nose, throat, ears, pulse oximeter. We can take your temperature, scale, blood pressure. We can listen to your heart and lungs. It is really cool, FDA approved technology. We have basically 2 different business models here. As long as I have a HIPAA compliant room, which could be a broom closet with some power and an internet connection, we can facilitate something like this. So the first business model I like to call Clinic Light. And for about 20,000 bucks in setup and equipment one time, we can facilitate training the HR person or the risk safety officer, et cetera, with minimal medical experience, can operate and maintain the equipment. The actual taking of the vitals is self-serve. We use augmented reality and some pretty sophisticated cameras to facilitate, taking of the vitals. Then we have, for a little bit more sophisticated customer that wants a little more capabilities, I call it the standard ACOS clinic. This is what we operate at the Safeway stores today. This is what you're seeing in the picture. We staff these with a medical assistant with a phlebotomy certificate. They're about a $15, $16 an hour employee, but now we can do rapid strep, rapid flu. We're doing coronavirus testing. We can take your blood and send that out to LabCorp. So there's a lot of things we can do that help enhance the experience and provide some significant cost savings in the process. This starts to make sense around 500 lives. Let's do a little math. Okay, example of a 500 life group financing that equipment over 2 years. Medical assistant fully loaded out for about $37.5. The ACOS virtual primary care plus solution at $48 PEPM, all in, including virtual DPC. So we can start that visit at the person's house. We can start that visit if they're on the road. Care navigation, chronic disease management, on-site access with vitals, fully loaded population health management, about $56 PEPM. Running a special right now through July, drops it down to about $54.25. Hey, let's do some super simple napkin math. We had 75% participation, about 50% employees, 50% families, rates at $450 and $1,600. You got about a total spend of $4.6 million. All in. If we just save 7.5%, 7.5%, it'd be about wash, right? It'd be about wash. If we saved about 10%, we drop about $120,000 to the bottom line. And what we're seeing in the marketplace today is like 17 to 21%. So you can imagine the return on investment is very real. Let's look quickly at the care management module for the employees. Again, patient summary with benefit wallet. They can schedule an appointment. There is a super cool functionality where we can interface with the PBM. The employees can share their medical records with the providers. That's what that QR code is, data portability. And then obviously that chat functionality, which is just super cool. We went through that care management portal. Again, it was more fun to just show you in person in live time, but these are some of the things that obviously we're able to facilitate. Here's some fancy reporting slides. Again, the big idea here is it is actionable when we get the information, and that is the key to success. ACOS versus the competition. I like this slide. This is a pretty good slide. We're way more comprehensive than telemedicine. That's a one and done. That's riding in a taxi. Brick and mortar. Look, I'm not looking to compete with a 25 life case across the street from the DPC doctor. That is rare. It's hard to scale brick and mortar DPC, right? And scale it in a meaningful way that's both increasing access to care and providing a uniform level of care navigation, and chronic disease management. Versus the on-site clinic, look, we're way less expensive. I was talking to an advisor the other day that did an on-site clinic last year for a client, cost them $500,000. They're paying a nurse practitioner $150,000 a year to facilitate care, and it is really affordable. Our model, 20 grand, right? And $54 a month, not a bad deal. Target markets, look, it makes sense for employers of all types. Low-hanging fruit, look, if you're an advisor working in the self-funded world, your ears should be screaming level funded, partially self-funded, completely self-funded employers. Employers looking to create a culture of healthy employees. Look, if you have a client that has a chef inside cooking healthy meals, they also need an ACOS med clinic inside their facility as well. How about self-funded workers' comp employers? That makes sense. Employees with industry with high workers' comp costs, manufacturers, meat processing facilities, agriculture. These are all things that are super low-hanging fruit. Employers with an existing on-site clinic looking to reduce costs. Look, there's lots of companies that are going to be hurting these days. They might have invested in an on-site clinic. Let's take that over, make it way more affordable, and get that return investment back. Super vogue right now. DPC, on-site clinics, super hot. If you got an employer that's thinking about it, we can deliver a really nice solution. Minimum enrolled on these plans and memberships, 10, right? Our target market, 100 to 5,000. Integrated DPC strategy with any plan design. We talked about the level funded stuff, partially self-funded, et cetera, et cetera. How about fully insured high deductible plan? Let's think that through. I talk to advisors every day. They're like, David, I'm out of gas, man. I'd love to take this thing self-funded, but the group 200 life case, 500, they're older. They got a bunch of health issues. Well, they're saying in the fully insured world, most likely. And let's use insurance for insurance. Let's raise that deductible to 6,000 bucks, right? Let's go with that 70/30 plan. It's gonna look ugly. It's gonna feel yucky to the employees. I guarantee it. Put in the virtual direct primary care. That's $0 copay. That's $0 access free to the employee. And then let us help the employee manage that deductible. It can be reasonable. Dealing with a ton of these types of groups all around the country, and it is a legit strategy. Okay. Hey, raise your hand if you're working with medical cost shares like Sedera, Shared Health Alliance, Altrua, Medishare. These are coming on strong, and it's not just small groups anymore. We've done several large groups with fantastic results. You can pair ACOS with these plans, and it makes a ton of sense. In fact, if you're working with Sedera, they give you a discount on the contributions to facilitate the offset of the direct primary care solution from ACOS. How about as a standalone? Makes a lot of sense. Look, during this epidemic, I'm literally pulling the people that I'm interacting with every day. And it's kind of weird. You know who I interact with every day being quarantined in my house? The FedEx guy, the Amazon guy that's delivering my packages, the person working the checkout at the grocery store, the lot porter that is taking my car to get an oil change. How about the vet tech? My German Shepherd King had to take him to the vet last week. The most bizarre experience I've ever had. They came out to my car, took the dog in a mask, took him in, and then 20 minutes later called me and had a consultation while they had my dog inside. That vet tech making 14, 15 bucks an hour. They need access to care too. So not only can you sell this attached to the major medical, you can sell this as a low-cost solution to any employer. They can help take care of their employees. Those are the people that are helping us through this time today. They deserve access to care too. And here's the deal: that poll, none of these people that I was interacting with had access to medical care. They're handling my food, my dog, delivering my packages. They don't know or have access to a primary care physician. We can change that together. Plan pricing, let's take a look at this together as well. We have two different strategies, if you will, and three different plan designs, okay? Our first two strategies, and I'll zoom in here in a minute, our first two strategies are called VPC and VPC Plus. VPC Plus is what I went through today. That is our Rolls Royce. That's the most advanced direct primary care solution on the marketplace today. It's an all-in solution. So whether we see a client once or 100 times, they're paying us a PEPM of $48, right, for an employee. Our virtual primary care solution, the one slightly to the left there, we introduced this and developed this product to really sit alongside low cost or affordable solutions, like, for example, a MEC plan or a medical cost share solution. How about a limited accident and sickness plan, or as a standalone type of situation, right? Really delivers that. What it's missing is some of the connectivity, reporting, some of the integrations with a TPA and PBM, et cetera, et cetera. Again, both of these solutions are based on a $0 copay. And remember, I was going to tell you about that reporting. We deliver these plans and the data and the interactions. All the CPT codes get reported to the TPA at a $0 modifier. So you get all the data, but it doesn't cost anything, right? The VPC Access plan, which is just to the right of the VPC Plus, that's a hybrid model, right? And we developed this solution mainly for large jumbo employers that are A, fully self-funded, and B, really understand their utilization and have great data, right? So it's a $15 PEPM that includes the technology, the care navigation, the chronic disease management, the health coaching, all the unlimited use of those services. However, when you do interact with the doctor, there's a $49 utilization fee, and that gets billed to the TPA, right? So in the case of VPC Plus, we're capturing data, $0 modifier. And the VPC access plan, we're capturing all the data. We're sending over the HCFA and the claim and the whole all the CPT codes with a $49 modifier. Hey, if you notice one click to the right, we got plus WC. That's workers' comp. For a small PEPM, we can add workers' comp. And for those groups that don't have people participating on the major medical solution or the healthcare solution, or purchase the solution as a standalone, we can add work comp for $5. So let's take a quick look here. I'll bring this up. A little bit easier to read, I'm sure, at least for me. VPC, VPC plus, VPC access, the work comp add, and then work comp as a standalone. There is compensation built into these plans. We have a really easy to use broker portal. When you come into the system, you actually create an account. And then once you create an account, you're able to add companies and then upload a census. Really simple. We can also do some little integration with a Ben admin, a TPA. We can use an EDI feed. We can use an API feed. We can even do an SFTP dump and grab the data. Once we receive all this information, again, we're pumping out texts and emails. It is a really easy and simple process. Look, thank you so much for joining this webinar today. I spend about half my day doing these presentations to consultants and advisors all around the country. And then the other half of the day, I spend presenting the solution with my partner consultants to their clients and their employers. It is a fantastic solution that is extremely relevant today. If you want to get an appointment and create an advisor account, go to that URL there. My personal cell phone and email is below. I appreciate everybody's attention and sincerely appreciate the opportunity to work with you to increase access to care and fundamentally reduce your clients' healthcare spend. Again, my name is David Slepak. I'm the Executive Vice President here of Business Development at ACOS, and I look forward to working with you soon.